All right, Chris from OrthoWell PT, best 3 strategies for low back pain. On the brochure, we talked about trying to find your neutral position. Okay, so there's a lot of different ways that people and PTs have taught this technique over the years. A lot of people have talked about just kind of pulling your navel in, you know, and a lot of Pilates teachers tend to say pull the navel in and flatten the back against the table. Okay, well, we're very evidence-based here in my clinic. Everything we do is for a very good reason. Okay, so what I'm going to teach you is very evidence-based, research-based approach to how to position your low back and how to engage your core. Okay, so first thing you want to do is find what we call your functional neutral position. Okay, so what you do, sit in this position here, or lay in this position here, feet flat, and then you want to roll your pelvis back as far as you can. That's posteriorly tilting. Okay, then other direction is anteriorly tilting as far as you can that way, and you want to explore the motion first and see how much motion you have. Okay, so once you get a feel for how far you can go one way and how far you can go the other way, try to find that spot that's in the middle. Okay, so all the way down, all the way up, and then halfway down. Okay, that halfway point is what we call the neutral position, and it should be a pain-free position as well. Because if you go all the way down here, it might hurt. You go all the way up here, and it might hurt. You're trying to find that point that's a safe zone in between the extremes of the motion. So functional neutral, there I have it. Okay. Then how do you engage your core muscles to maintain that neutral position? That's what we call bracing. Okay, I want to brace my core. It's kind of like I'm trying to create this bracing effect in my muscles around my core, similar to what you'd have with the bracelet you put around you. Okay, so what's great about this is that once you learn it, you can brace with your muscles internally, and then brace externally with the corset or the sports brace. You got 2 for the price of 1. Okay, so you got my neutral. When I go to engage my core, I cough. Okay, so cough, and when I cough, my belly comes up. So cough. All right, and then think about grunting or bearing down. My belly still comes up. Okay, that's bracing. That's true bracing of your core. And when that happens, you have many different muscles that are happening simultaneously, and you have a tensioning of the thoracolumbar fascia that's in your low back as well. So if you feel somebody, once they're bracing, you can feel this tensioning effect that's occurring in your lumbar spine. So it's not just one muscle, being the transversus abdominis muscle that you use when you pull your navel in. When my belly goes out, I'm engaging many things at the same time. That's the effect you want to have. That's more of an evidence-based way of really promoting as much stability as possible, throughout your core. Okay, so I got my neutral, down, up, middle, and then I brace and engage, and then release. And just as you're doing this for starters, just feel that motion. You got your neutral, I'm there, okay? Feels like I'm in my neutral there, and then engage my core. 1, 2, 3, 4, 5, release. Okay? Same idea. I got my neutral and brace, and all I'm doing is I'm thinking about grunting, bearing down, or that coughing effect. Don't cough every time you do this. Think about what it feels like as you cough and that belly coming up. Okay? Then all the stuff we talked about earlier as far as mechanics go, when I get out of bed, I got my neutral, I got my brace, and I'm rolling all the way over and then back up. Okay? I'm going to also refer you to a video I've done before on bracing, on functional neutral training, just to emphasize this stuff with you. We still don't want you to go out and do exercises unless you consult a physical therapist. You start doing stuff prematurely, or you do the wrong thing, all this stuff is going to be pretty much done in vain because you're just going to serve to irritate it. So give us a buzz. We'll go ahead and do some sort of consultation or consult a physical therapist locally that you trust and know does an effective evidence-based job, and things should come along real good. Okay? Thanks.